Welcome, Dr. Ganguly. It's so good to have you here at the space for our ongoing health series with St. Charles Hospital.
Thank you, Kevin. It's a pleasure to be here.
So good to see you. You know, they say topics, right? They can be as serious as a heart attack. And really today's topic is serious, but I have a feeling we're going to get to some good news about coronary heart disease and what you do as a specialty. So if you would, let's tell our audience your experience as a cardiologist.
Well, my experience is quite long. I've been doing this for more than 40 years.
40.
That's a very long time.
Absolutely.
And I've had the privilege of seeing how cardiology has evolved. I started cardiology in 1980. That's a long time ago. And since then, there have been so many advances, and people's lives have been saved so much that I find it fascinating and a privilege to be part of it.
Absolutely. If I may, I'd like to go to an experience I have. It's the only experience I have with heart disease and a heart attack. And unfortunately, it's my lineage. My grandmother, on my mother's side, I remember as a kid, actually her having a heart attack. And then I also remember it was 1985. So I don't know how things have changed, and we'll talk about that. But obviously, losing a loved one to a heart attack and understanding the hardening of the arteries, that's all I heard as a kid. You know, she's got the hardening of the arteries. So why don't we talk about that? I understand that the leading cause of death, is it death in the United States?
Is heart attack.
Is heart attack, which is incredible. But is this only since they've been tracking it, or is it since 1950 because things have gotten progressively worse in our diet? If we could talk about that.
Well, I think it is both. One of it was before the 1950s, a lot of people died of infections, of injuries, and heart disease were also not being tracked as much. Since the 50s, there have been these landmark trials that have looked at longitudinal progression of heart disease. Notably, there was one in Framingham that tracked people, and that showed the incidence of heart disease. And there are multiple factors that have caused the increase in the incidence of heart disease. Now, today, women, unfortunately, have taken over rather than men. Every year, approximately 3 million women have heart attacks, of which about 200,000 die. Every single minute, one woman dies of a heart attack in the United States.
What do we attribute this to?
Again, a multitude of factors. Back in the day, men were more in the workforce. They smoked more, they ate high-fatty meals, and they drank more. From the 70s onward, women started entering the workforce much more. Unfortunately, they picked up the men's bad habits. And there is more smoking amongst women and more
Stress.
poor dietary habits and stress.
Stress because maybe they're taking, not maybe, there's a two-person workplace. There's a two-spouse workplace, more so than ever, correct?
Yes, but unfortunately, the woman actually has to carry the greater weight. Men get away with not having to do the housework. Women do the housework and do the workplace. So they're really carrying two jobs all the time.
Right, and their responsibility for family and whatnot.
Precisely.
When we talk about men and women, what symptoms come up with men and women to indicate there might be heart disease, and is it different between men and women?
Let's talk about two aspects of it. Let's talk about heart attacks, and let's talk about the heart disease. Heart attacks in men classically described as this crushing sensation in the center of the chest or in the left side of the chest, or sometimes a sharp pain or somebody like a weight sitting on the chest. Women may have that. The vast majority do have that. But there are also other symptoms that women have which they tend to ignore. Women tend to manifest such as with shortness of breath, with nausea, with dizziness, back pain, and sometimes with abdominal pain, which they think it is, it's maybe the time of the month, but it may be heart attacks. In terms of heart disease, men again tend to present with chest discomfort. Women may present with shortness of breath rather than chest discomfort. And it is incumbent upon the physician to take the women's symptoms seriously and not to poo-poo it.
I never knew about this abdominal pain,
Yes,
which would never normally present itself as a possible problem.
precisely.
So if this persists, for example, and a woman said to the doctor, I have abdominal pain, and everything else is ruled out, what's the next step?
Well, first of all, if the doctor is worth his or her salt, they will get the history properly. Then you have to look for the risk factors. The risk factors for somebody is, do they have a family history? What is their cholesterol level? Is it high? Do they smoke? One of the biggest risk factors, do they have high blood pressure? High blood pressure is a huge risk factor which is woefully undertreated. Then, after they do that, they can do something simple as an EKG. The EKG is a 30-second test. Tells you, have they had any changes on the EKG? From there, they can go on to something which is like the calcium score. Or if the symptoms are indicative that there may be something going on, they can do further testing like a stress test or imaging of the heart in different fashions. There's lots of ways to do something which is non-invasive without missing the boat.
The calcium score test, how new a test is it?
It's been around for about 20 odd years. It's a well-validated test. It came about when they started doing CAT scan, which is the computerized tomography of the heart. They noticed there will be streaks of calcium which show up as white flecks. And they followed distribution of the arteries that supply the heart. So they started looking at that, and then they started quantifying it and giving it a score. And when they give it a score, it's a numerical score based on the distribution of the calcium and how much calcium there is. Now, what everybody hopes for is a score of 0, meaning there's no calcium.
The lower the score, the better.
Absolutely. Now, 0 to 100 is there is some calcium. You should be careful, but not something you should worry about yet. But be aware, you don't have to be on medications. You don't have to be on any intervention, but be careful with your diet. Between 100 and 300 is an intermediate group that says, you're at a moderate risk. Maybe we should do something about it, such as starting somebody on a cholesterol-lowering medication. First and foremost, with everybody, if you smoke, stop. That's for everybody.
It's bad.
Bad. Bad, worse than bad, better than bad. If you have high blood pressure, make sure it is controlled. Over 300 is high. Then you got to investigate further as to seeing, what does this over 300 score mean? It doesn't mean it's woe and doom, but it's something that you do not ignore.
When does the calcium score absolutely say to you as a doctor, you have blockage, or does it? Or do we go to further investigate because of the score and then indicate and come out with the possibility that you do have, or you absolutely do have blockage? When does the blockage come up? Does the calcium score ever indicate blockage is what I'm asking?
The calcium score by itself does not tell you if there's a blockage. It tells you that it's the classic story. It's the canary in the coal mine.
Okay.
It tells you there is something wrong, but it does not mean there's a blockage. You have to do further testing to see if there is blockage. Further testing means you either go and get what's called a coronary CT angiogram, in which an intravenous injection is given, you're given a contrast material, and you take pictures of the arteries of the heart. Or you get a stress test. And typically that stress test would be with some kind of imaging so that you can see if there is lack of blood supply to the heart. That's when you know the actual calcium deposits in the arteries are causing a problem rather than it is there.
We're going to backtrack for a second, then we're going to talk about blockage. How bad is alcohol or drinking for the heart compared to smoking?
Oh, smoking trumps everything. Smoking is uber alles, absolutely the worst thing you can do. It's the worst. You can have a steak every day. It's still better than having cigarettes. However, the steak every day is also not good for you. But let's talk about alcohol. Alcohol is a direct depressant of the heart muscle. There is mixed data because when you see the Europeans, like the French, they smoke, they eat fatty food, they drink red wine, and they don't have as much heart disease. So everybody says, hey, that's the French paradox. What they're not recognizing is the French paradox is because they walk everywhere. They exercise. They're not sitting on the back of a car driving someplace. They're walking, and they're all skinny.
Yes.
So they're skinny walkers. So they eat some foie gras, and even the amount they eat is tiny. You eat a steak in France, it's teeny tiny. You eat a steak anywhere in the U.S., it'll
Everything
feed a
is
whole
extra
family.
large. Yeah, extra large here. Okay, so let's talk about now you have a blockage. You've confirmed it. What are the different ways that can be treated, and what's come up lately that's just been hopefully magnificent compared to in the 80s where we only had a few ways to treat blockage?
I think the number one miraculous treatment is not a procedure. The number one miraculous treatment is an understanding of the medical treatment of heart disease. Not necessarily the fanciest new toy that you can put down. It is back, I was in the original meeting where statins were first introduced. This was in the late 80s in Anaheim at the American College of Cardiology when they first introduced statins. The room was a ballroom, it was an auditorium, and it was completely packed. Because this is the first time you could actually lower cholesterol. And there was a huge study called the 4S trial, which showed reduction of cholesterol mattered. So, the important thing is, although you can get a stent, and I'll talk about that in a minute, although you can get a stent or a bypass, that actually only treats a localized area of blockage. But you have to remember the entire artery is diseased. So it's medical treatment which actually helps the most. But other interventions buy time so that the acute block that can occur is removed so you can remove the rest of it.
Right.
Just getting a stent and then going back to your habits of smoking and eating steak is going to cause that stent to close and another one to also happen.
The lifestyle is very hard, isn't it, with Americans, to change lifestyle?
That's an understatement.
I know.
It's an understatement. You know, it's interesting. I have seen pictures of people on beaches in the 70s.
Yes.
Okay? They were mostly skinny.
Yes.
Men and women. They didn't have to be beautiful, but they were skinny. Look at a beach in the 2000s. They're corpulent.
I know. Look at the famous music festival in 1969, Woodstock, where there were 500,000 people. If you really look at that, I don't think I've seen anybody overweight.
There was nobody.
1% maybe. It's absolutely incredible. It's sad too.
Yes.
What happened? Advertisement of food? What happened?
Industrialized food production.
Yeah.
It is. Back then, if you wanted a steak, it was grown on a ranch in Montana or something, which was grass-fed. Now there is factory farms.
Yeah.
Where there is thousands of cattle being fed corn and hormones and antibiotics.
How often should someone have a calcium scoring?
It depends upon your risk factors in terms of your family. Maybe 3 to 5 years.
Every 3 to 5 years.
Yes, because it changes.
Yeah.
If your risk is higher, maybe 3 years. If it is low, maybe 5 years. And below 50, it is less likely to be productive because it takes time for the calcium to get deposited. And by the same token, after 70 or 75, it's a waste of time because everybody's got calcium. Then the question comes up is, what importance is the calcium to the patient's overall health rather than actually the presence or absence of calcium?
Interesting question for you. What is the average age of a heart attack today with a man and a woman? You may or may not know that.
I don't know the average age, but I do know that up until the age of 60, women actually have a higher incidence of heart attacks. Over 60, men have a higher incidence of heart attacks.
Okay.
You know, there are like I said before, 3 million women have heart attacks every year.
In the United States?
In the United States. You know, 20% of the population of the United States has some degree of heart disease, of which 50% are unaware they have it. That means 10% of the adult population of the United States has heart disease and is unaware.
It's incredible.
Yes.
So great news here in Port Jefferson, Tuesday the 13th and 14th. We can help with the diagnosis of heart disease with a screening event, 2 days. No insurance is necessary. Of course, an appointment is necessary. Space is limited, I understand, but
that is correct.
This is a wonderful opportunity. Maybe explain this, and will you actually be on premise?
Absolutely. Let me tell you what happens. It's a very simple test. Patient comes in. There's really no prep required. No preparation, no intravenous, nothing.
So you don't have to not eat something or eat
nothing,
something?
None of that.
Just be yourself. Come
Just
as you
be
are.
yourself. Wear comfortable clothing.
Mm-hmm.
You lie down. The whole thing takes 10 minutes. They take a low dose, low radiation CAT scan of the chest.
Okay.
Then software is used to find out where the calcium is and where the scoring is. Actually, there will be no physician physically there because it's not necessary.
Okay.
The technologists who do this are very skilled. They do this all the time. They will do it. I will review the results. And at that point, I will discuss the results with the patients and the patient's, I will forward the results to the patient and the patient's physician if the patient gives us the information. I'll be happy to see them, but they will be needing to make an appointment because it's impractical to do so otherwise.
Absolutely.
But there's resources available to the patients, either through their own physician or through my practice, to be able to help them.
So, of course, doctor, men or women are welcome between the ages of 40 and 70 for the reasons that you talked about before.
Precisely.
Which is absolutely perfect. This is in and around Valentine's Day, so
it is. That's why they chose it as hard.
Do your loved one a favor and yourself a favor. I am going to do this. Actually, I will
Good
be there.
for you.
I will be there. I'm prime in that space, and I am kind of. I don't want to say I'm dying to because that wouldn't be right, but I'm interested in comparing my scores because I had this score about 3 to 4 years ago, so it falls right into what you were talking about, and I don't mind sharing it with everybody. So thank you for your expertise. You're just really a wealth of knowledge. I feel very, very fortunate to have you here in Port Jefferson.
My pleasure. My pleasure.
Absolutely.
This is what we are here for. St. Charles is here for that. We are here for that. We want to help the community.
Thank you again.
My pleasure.